Hello and welcome if you're watching in the UK or around the world. European Union countries will consider whether to halt air travel from the southern Africa region while scientists investigate the new variant of COVID which has now emerged there. Germany, Italy and the Netherlands have already joined the British government in introducing urgent travel restrictions on South Africa and neighbouring countries because of concerns about the strain, which scientists fear could be more infectious and better able to evade vaccines. The variant's potential danger is still not fully understood, and only a few dozen cases involving it have actually been confirmed. Well, the UK will halt all flights from South Africa, Namibia, Zimbabwe, Botswana, Lesotho and Eswatini this afternoon. From Sunday, travellers arriving in England from those countries will have to quarantine. Germany's restrictions will begin tonight. Cases have been identified in South Africa, Hong Kong and Botswana so far, but no cases have yet been confirmed in the United Kingdom. Britain's Health Secretary Sajid Javid says the variant has a significant number of mutations, which means it could be more transmissible and that current vaccines could be less effective. Scientists say the new variant is the most complex that they have seen and also the most worrying. Our medical editor Fergus Walsh has this assessment of that new variant.
The speed at which new and stringent travel restrictions have been imposed show just how seriously this variant is being taken. Between 500 and 700 travellers arrive in the UK from South Africa every day. That's where most of the cases have so far been identified and where it appears the variant may be driving a new wave of infection.
It may be more transmissible than the Delta variant, and the vaccines that we currently have may be less effective against it. Now, to be clear, we have not detected any of this new variant in the UK at this point in time, but we've always been clear that we will take action to protect the progress that we have made.
The new variant was formally identified only 3 days ago. Genetic analysis shows it has twice the number of mutations as Delta, the dominant variant worldwide, including around 30 changes to the spike protein, which the virus uses to break into human cells. This makes it dramatically different from the original Wuhan strain, on which all current vaccines are based. But crucially, there is no evidence yet that the variant causes more severe disease or that it makes vaccines less effective. It will take 2 to 3 weeks before laboratory tests can show whether this is another defining moment in the pandemic or a false alarm. Fergus Walsh, BBC News.
Well, Professor Ravi Gupta is a clinical microbiologist from the University of Cambridge and explained what we know about this new COVID variant.
We know that the variant has been isolated in southern Africa, in particular South Africa, where there appears to be quite a rapid growth of the virus in a number of provinces. And that this virus is notable because it has a number of mutations, a greater number than we've ever seen before in a SARS-CoV-2 virus. It has a total of around 50 mutations, 30 of them being in the key protein that we study and we use to vaccinate against, which is the spike protein which sits on the virus surface. This spike protein engages our receptors and gains entry into our cells. And it is also the target of many response following vaccination and natural infection. So it really is a critical part of the virus. And we're seeing a large number of changes occurring in this new variant.
And of course, now the race is on to try and find out just how contagious it might be. How long will that take and whether or not it stands up to the vaccines that we have?
It's spend time. The laboratory experiments will probably take between 3 and in the meantime, I think that the ground knowledge from the excellent public health and research networks in South Africa will give us real-time information on what's going on. We're very lucky because actually the variant can be tracked by an anomaly in PCR testing that occurs with this variant, and we saw it before with Alpha, so there is a way of tracking it very quickly as it spreads, and that is going to be absolutely vital in understanding how fast this thing is spreading.
That's Ravi Gupta. Well, let's get more about the concerns about this new variant from our correspondent Andrew Harding, who's in Johannesburg.
The one thing scientists here say they are sure of so far is that this is a highly transmissible variant. They've seen how quickly it has spread through the province of Gauteng, which is around Johannesburg, and it has now pushed out any other variants. And there is evidence that it appears to be spreading faster than previous variants in previous waves here in South Africa. So that in itself and alone is cause for concern, certainly. As for the details of the impact of some of these mutations, right now scientists are studying those very closely. They don't expect to have results, though, for some weeks. And obviously they'll be waiting to see the impact on the population as a whole here and the extent to which the penetration of vaccination rates here will provide some safety and some defence.
That's Andrew Harding in South Africa. Let's go to our correspondent in Berlin now, Damien McManus. And Damien, clearly real concern in the UK about this variant that's emerged in southern Africa. And what about Europe and Germany as well? What kind of alarm bells are ringing across the EU about this?
Yeah, very similar debate, really. So Italy has now just introduced a ban on travel for anyone who's been in those affected Southern African states within the last 14 days. Germany this morning also introduced new restrictions, meaning that only German citizens arriving back to Germany from that affected region would be able to enter the country. And EU Commission President Ursula von der Leyen has also announced that she wants to coordinate action between EU member states to restrict or possibly even ban travel from that region, because, you know, we're seeing here very similar debate really to in the UK. Great concern over that region spreading, and people want to buy as much time as possible to stop the variant coming to the EU.
All right, Damien, for now, thank you very much indeed. Damien McManus there for us in Berlin. And Dr. David Nabarro is Special Envoy of the World Health Organization on COVID and can join us now. David, good to talk to you. Thank you very much for being with us. I mean, a lot of concern. We've already heard it from the UK government and EU governments as well about this new variant. How worried are you? Because we have seen variants and mutations before, and no doubt we'll see them again. But is this one different, do you think?
Well, I was going to just start with that way of talking. You know, when you're dealing with an infectious disease like COVID-19, you expect the virus to mutate. As the months and years go on, the number of mutations will increase. Most mutations don't end up making the virus any more viable, but just occasionally mutations do occur that are troublesome. And we know about Alpha, we know about Delta. And now we have another one. And of course, there will be concern. The World Health Organization Technical Advisory Group on Variants is meeting today, and they will explore just how to approach this new one that's provisionally called Variant New. My own view is that that really it is appropriate to be concerned about this. I'll tell you why. The virus looks like it will have greater capacity to evade the defenses that we've all built up as a result of the vaccinations we've received since the beginning of this year. And that is a concern, because that would then mean that it's a bit like having to reset the dial and to go back and start dealing with a totally new pandemic all over again. We have to treat it as a new virus. So that's the concern. And the only thing I want to say to people is, remember, the way we deal with a pandemic like this is we do everything possible to stop the virus being transmitted. So as well as trying to get everybody vaccinated, the really important thing is wear face masks, maintain physical distancing, practice good hygiene, and try to ensure decent ventilation, particularly in indoor areas.